Hospitals like Mercy are quickly finding that there might not be enough doctors and nurses to deal with this crisis if things continue on the path that we're on. Because here's the thing, highly skilled professionals can't be replicated. The New York Times reports this week that the United States has manufactured more than 200,000 ventilators since March. But while many hospitals in COVID hotspots have the supply of ventilators they need, they don't have, quote, nearly enough respiratory therapists, pulmonologists, and critical care doctors who have the training to operate the machines and provide round-the-clock care for patients who cannot breathe on their own. One emergency room doctor telling the Times, quote, we can't manufacture doctors and nurses in the same way we can manufacture ventilators. The ER doctor echoing what we heard from that news report out of St. Louis. We cannot make more doctors and nurses. All across the country, we're seeing these same cries for help, like this one from a respiratory therapist in Omaha, Nebraska.
I work in the COVID units almost daily. They are filling up very, very fast. So just wanted everybody to kind of have an idea of what we have to go through. This is a ventilator. Our sickest patients go on this almost immediately when they come to the hospital. For our other patients who are still very sick but not needing the ventilator, we have high flow systems that they go on that push that air into their nasal passages and down into their lower airways, hoping to oxygenate and ventilate them. It's very, very taxing because we have to go in and out of the rooms all the time because these patients drop their sats very quickly because they're not able to keep that oxygen within their lungs. So all that I ask from the community of Omaha and countrywide is to please wear your masks, if not for yourself, but for others, because it's not easy and we're doing our best.
I still have my job at the hospital, and it's become very hard since COVID started. We never know if we're going to walk into a good day where you can see your patient finally leave who's been there for 2 months, or if you're going to sit there and hold the hands of patients as they pass. And some days I can handle it and some days I can't. It's hard. I love what I do, but when the only thing keeping you going is your coworkers and everyone's getting burnt out, it's a struggle.
Everyone's getting burnt out. It's a struggle. In the Midwest, especially, frontline heroes are just fried. They're not only understaffed, they're also in the midst of this catastrophic surge, which has now pushed them over the edge. But it's not just a Midwest problem. It's an everywhere problem, spreading at an alarming rate. The United States hit the grim record of over 2 million new cases in the past 2 weeks. If this rate keeps up, we could see over 4 million cases in November alone. Over 88,000 Americans were hospitalized yesterday, and that number keeps going up and up. Behind each of those hospitalizations, there are countless highly trained, highly skilled frontline workers treating every single one of those patients. They are being pushed beyond their limits, and there isn't an end in sight. So as we reflect on what we're thankful for this Thanksgiving, let's not forget the frontline workers who risk their lives every single day to keep us all safe. That's the least we can do.